Section 8.10, Staff PPE for First Aid. Keeping PPE dry and organized. Each lifeguard will have first contact PPE on their person, so in their fanny pack, including gloves and 2 surgical masks. This allows for a surgical mask to be put on by the lifeguard and the patron that needs assistance. The gloves and surgical masks must be kept in a resealable Ziploc bag to avoid getting wet. Each focal point will have a dry storage container that includes PPE for 3 rescuers, 1 victim, and 1 bystander, along with resuscitation equipment, BVM with viral filter, as well as viral filters for pocket masks, hand sanitizer, and disinfection wipes. Lifeguards will also have a pen for personal use and hand sanitizer available in all rooms of the facility. Individual disinfected PPE will stay in each staff member's locker at the end of their shift. When to use personal protective equipment for first aid. This chart was supplied by the Life Saving Society. At no contact, we have 2 meter physical distancing maintained and we're in the green zone. The lifeguard must still wear a face shield, surgical mask, and gloves, and the victim must be wearing a surgical mask. We then go to direct contact, the low risk, non-aerosol generating, 2 meter physical distancing not maintained yellow zone. The lifeguard must wear face shield, surgical mask, gloves, protective gown, and the victim must also wear a surgical mask. A reminder that while we are doing first aid, a disposable surgical mask must be worn and not the reusable mask that will be provided by the facility. We then go to high risk, aerosol generating, with chest compressions, ventilations, oxygen administration, abdominal thrusts or back blows, where 2 meter physical distancing is not maintained and we are in the red zone. Lifeguard must don their isolation gown, their face shield, surgical mask, and gloves. The difference between the isolation gown and the protective gown is that the isolation gown is disposable and is a white Tyvek suit. The victim must then be helped with the BVM with a viral filter and a continuous seal maintained, or with a pocket mask with a viral filter, a surgical mask if you're doing compression-only CPR or other treatment if the BVM or pocket mask with a viral filter is not required. And for CPR, mouth and nose must be covered at all times, sealed BVM or pocket mask with those viral filters. Types of PPE used for first aid. Surgical mask, 3-layered disposable. Reduces transmission of aerosol by 50% and protects from contracting aerosol route infection from others by 75 to 80%. Surgical masks must be dry to be effective. Surgical masks must also be worn over both ears, and the nose piece must be pushed down to fit the curve of your nose. Masks and face coverings are prohibited in the water as a lifeguard. So if you're going to jump in to begin a rescue, the either disposable or the reusable face mask must come off your face. Types of PPE used for first aid. Eye protection. Face shields prevent virus exposure of the eye mucosa. Each lifeguard will have their own face mask to wear daily when administering first aid at any level. They will be disinfected after each day by the staff member. Corrective eye lenses and safety glasses are not approved PPE for first aid and should not be used for first aid purposes. Types of PPE used for first aid. Body protection. Long-sleeved, water-resistant gowns should be used when performing high-risk first aid treatment. Practice personal hygiene following use. Minor first aid, yellow protective gowns that can be disinfected after use with our green Buckeye cleaner. Major first aid, white Tyvek suits that will be disposed of after use. Types of PPE used for first aid. Pocket mask with a viral filter. If a pocket mask is used, a continuous seal must be held by a lifeguard. Viral filters are located in the dry bags at the focal points. A viral filter differs from a one-way valve by holding in the aerosols within the filter and keeping you safe from any COVID-19 droplets. Big valve mask with a viral filter. The viral filter, or high efficiency particulate air HEPA filter minimizes the risk of the virus spreading during ventilations. Viral filters must remain in their original packaging and remain dry to be effective. Most of this PPE is required to remain dry to be effective, which is why we have a dry box located at our focal points now.